Hi everybody, welcome to Healthline. I am Gregory Zarian. Thank you so much for joining us. Okay, so summer is almost here. Are you ready? Are you getting ready to go to the beach, go to the mountains, spend time with your friends and family? Are you ready to put down the phone, close the computer, get off the TV, and go outside and get some vitamin D? That's what summer is all about. Family, friends, getting more of your health on, and just being one with nature. And as we always do on Healthline, it's about taking a deep breath in and taking a deep breath out. Now, as summer's here, it's right here, and you spend time with family and friends, you also get to spend time with your pets. Do you have a cat? Do you have a dog? Do you have a bird? Do you have a snake? Some of my friends even have pet rats. The entire conversation today is all about pets. Did you know that a dog, or spending time with a dog, can release something called oxytocin? Oxytocin occurs also with adults and people when we hug. After 10 seconds of hugging someone, oxytocin is released in the brain, and it just makes you feel good. Did you also know that pets are used as a type of therapy for patients and people that are rehabbing from surgeries and any physical malady to get better, feel better, and get unconditional love? The entire conversation is all about a woof. So, joining us is Dr. Aaron Selzer. He is a specialist in physical medicine rehabilitation at Glendale Adventist Medical Center. How are you, doctor?
Good, thank you.
That was a mouthful.
Yeah, it is a mouthful.
So, what exactly do you do, doctor?
In my specialty, physical medicine and rehabilitation, we treat people whose primary problem is that they're disabled.
Okay, so it's specifically just disabled.
Yes, but you can be disabled by many different things. So that would include not only disabilities from strokes, broken bones, spinal cord injuries, head injuries, but also pain, things that cause pain, neck pain, back pain, shoulder pain. Anything disabling comes under the treatment of somebody in physical medicine and rehabilitation. What
got you into this field, doctor?
That's an interesting question. I actually started out in an internal medicine training program, and I was at Cedars, and I wasn't very happy with it. The reason I wasn't happy with it is that I didn't really feel like we were helping people get better.
Oh, I love that.
I thought we were just preventing people from the inevitable.
Sure.
The people I was dealing with were so sick. Their quality of life, in many instances, was clearly gone, and I didn't feel that we were exercising appropriate judgment in what we were doing for people. I thought we were, in a sense, prolonging perhaps misery or poor quality of life too long, rather than focusing on people who were getting better. And at that time, I happened to run into two young physicians, my age at the time, who were both in the beginning of physical medicine and rehabilitation. And they were exuberant about that specialty for various different reasons. And so I went and talked to the residency director at my hospital, and although they didn't have any spots, by the time I finished my first year of internal medicine, they had gotten funding for an additional spot, and they offered it to me. So I really jumped into it. And the reason I stayed with it is because I immediately got this sense that we were helping people get better.
Do you feel that most facilities don't help keep people get better? I mean, I know there's a type of rehabilitation, and there's, that they will get them well enough to leave. However, getting better is such a strong, impactful sentence.
Right. I wouldn't go so far as to say that most facilities in any way keep people from getting better. That's simply not true. But what I will say is we, as a society, spend a disproportionate amount of our resources on people who are in the very last stages of their life.
Got it.
And I think there's a case to be made that that's not the best place to spend that money. We should spend it on people who have long lives, and we can really promote their health and well-being for a long period of their life.
Which also, and when you say getting better, what does that mean, doctor? I know that when somebody's near the tail end, per se, of their life,
right.
we understand what that is.
Right. Well, the tail end of your life, unfortunately, it means you're not feeling as well. You're not able to do as much. You may not be able to walk. You may have to spend time in bed. You may not be able to do the things that you would need to do for yourself, like use the bathroom or
Sure.
get yourself dressed. You may rely on other people to do those things. Your quality of life is not good. You're not able to go out and do the things that, for most people, make their lives interesting. Spend time with family, friends, hobbies, activities. At the end of your life, you're increasingly less able to do those things. Often your mentation is failing, so you're not really that aware of what's going on. And you're not feeling that well. Often there's pain, there's discomfort. So the quality of life at the end of someone's life, unfortunately, is not all that good. So I would that's end of life. So talking about people getting better, we're really just moving in the opposite direction.
Let's dive into right now
Okay.
about somebody that you were saying earlier. Just say somebody suffers from a stroke.
Right. So if you have a stroke, often it results in disability.
Got it.
Right. And
because when people think of disability, the thing that kind of came to my mind immediately was somebody that was older.
Right. Although that's not always the case.
Exactly.
But certainly disabilities more frequently occur in people who are older, but certainly not exclusively. Lots of young people have accidents, strokes, brain injuries, spinal cord injuries, so it can occur in a young person as well. But so when someone becomes disabled, the term disability refers to the fact that there's certain activities you can't do. So if you're disabled, you can't maybe walk, you maybe can't dress yourself, you maybe can't drive, you maybe can't play soccer. So the disability affects your ability to do some activity. And so when you have a stroke, as an example, often we lose the ability to control one side of our body or talk. But with rehabilitation, we can help people get stronger. We can help people accommodate to their impairment, their weakness, so they're able to do things anyway.
And you also help people get their life back. Now this is a great, this is a great rehabilitation cliffhanger. So don't go away, take a deep breath. There's a perfect way that we're incorporating the power of the woof. Do not go away. More on Healthline when we come back. Welcome back to Healthline. Did you have a nice break? Did you get a glass of water? Did you have a carrot stick? Did you turn off your phone and shut your computer? Or did you go to Facebook and find us at GAMC Healthline and invite all your friends? Because the entire conversation is about whole person care, health, and wellness. Because our mission here is to bring you antidotes and recipes and everything you need to know about being the captain of your ship and getting your hashtag health on. So the conversation has been about rehabilitation, how to make your life better. Joining me is Dr. Aaron Selzer, specialist in physical medicine rehabilitation. We were talking about the extreme of having someone near the end of their life having a better experience. We then fast forwarded to someone, maybe not so much depending on older, but middle age or even younger, maybe suffering from a stroke or a heart attack or something like that, and they are disabled, and finding ways to make their disability and their experience better. So, doctor, I brought up the word wolf, dogs, man's best friend, the power of the wolf. How can an animal help someone feel, we all know. You come home, the dog is there, you play with them, you rough and tumble and do all that. How is there physical therapy involved with animals and people that are disabled and getting better?
Well, pets throughout history have offered a lot of comfort to mankind. And, some people even believe that mankind's development of civilization was in hand with pets, because pets are able to apprise us of danger that we may not be aware of. And when a pet is sleeping quietly at our side, it's reassuring, and actually it's a very good sign that there is no danger lurking about. But pets are very comforting to us, and so we bring pets to see our patients who have become catastrophically disabled. They were well before, and then they've had a stroke, or they've broken bones, or they've had a head injury, or they've gone through a major surgery, or they've stopped breathing. So they're in the hospital, they're rehabilitating, they can't go home, they're not ready to function, they're in a strange environment, and it's very anxiety provoking to be in a unfamiliar setting and where your body is not where you're used to it being. So
it's your prescription to then bring in a pet.
A pet is very comforting, and there's very good evidence that it helps people socially, helps their mood, helps them mentally or cognitively, helps their motivation. It helps them calm down. It helps them feel better.
So this is some of the physical health that we did research on that found out that this is what happens to you if you bring a pet into your room. It lowers your blood pressure. How is that? Is it just the calming?
Yes, calming, a physiological effect. Yes, absolutely.
So then you at home, if you're in a bad mood from your work day, get a pet. It'll calm you down. You'll be nicer to your friends, and you'll learn how to relax. And it's also about, when you have an animal, it's also more unconditional, and it's not all about you, because we personally implode when we don't have something else or someone else to take care of. Do you not find that to be true as well?
That's true, yes.
It improves cardiovascular health. How?
Well, probably the way it helps cardiovascular health is that our dog takes us on a walk every day.
Love that.
So, yeah.
Okay, here's another thing too, people. For those of you that are suffering with weight issues and being a little bit more stagnant in your health, close the computer, turn off the TV, take your family and go out for walks. Minimum of 150 minutes a week for minimum cardiovascular exercise. It releases endorphins, as I said earlier, oxytocin that has a calming effect. It diminishes physical pain. How is that?
Well, let me tell you, a lot of people don't exercise their bodies.
True.
A lot of people, especially in our community, unfortunately, retire to the sofa when they reach a certain age.
Well, that's why we're also the most obese country in this world.
Yes, that's right. But when all of a sudden something happens to you medically and your body needs to recuperate, if you don't have enough physiologic reserve to recover, you're not going to do as well. And just like you said, 150 minutes of exercise a week, 20 minutes a day. Even better, if you could manage to take an hour walk every day, your life will be so much better. You'll recuperate so much better if anything happens to you. It's better than any drug out there.
You breathe, as I said to my older brother recently, there was a moment where his lack of exercise, and I said, it's kind of like you become a car stuck in a parking lot that is broken down, and you are being affected by all the elements, heat, cold, wind, and no one's turning you on.
Yes.
And that little bit every day.
Yes.
Okay, so we've discussed, and we also have the active petting produces an automatic relaxation response, reducing the amount of medication some folks need. Crazy. Crazy.
There's some studies that it improves pain having a pet around. Yes.
So with that being said, we stop at nothing to bring you great shows here on Healthline. We have two special guests. Joining us right now are the lovely Karen from Therapy Dogs International and her lovely partner in crime, a gorgeous Doberman, Alon. And I'm going to be a gentleman. I'm going to stand up. Karen, you and Dr. Zelzer know each other?
Yes. Alon, come here.
How are you?
I'm fine.
So, with everything that I just said, what is the marriage then between you two? What is the connection between the hospital and Therapy Dogs International?
They wanted to start a program, and so they talked to me. I've been doing this for 10 years. This is my 4th therapy dog that I've trained and worked with. I've seen the miracle of what a dog can do going in a hospital or working with children, working with children that have autism, working with children that have special needs, working with children with very big emotional problems. I've been in a hospital where they said a patient wouldn't respond, has done nothing, especially in the psych unit. They're older, they've been there the whole time, they haven't spoken. The dog comes in, and it's like magic. They want to talk to the dog, they want to pet the dog, they want to get up and get dressed and go to the recreation room. They want to be there to play with the dog, to touch the dog.
Then, what is that, doctor? If, rehabilitation specialists come in, doctor, you as a doctor come in, someone I love is in their bed and they're not responding to me, but in comes Alon. What is the difference between the human touch and the canine touch?
Well, dogs are so unconditionally loving and accepting. They bring such comfort. I'm not sure you can explain it. But we all experience it. There's just something about a dog that they're so lovely and they're so loving, they just bring out the best in us. And, it's when we're children, we fight over the dog because we want the dog in our bed. I mean, we want to be with the dog.
We do.
Yeah.
I'm one of 3 boys, and we had a long-haired German Shepherd named Tiger. And my father was like, don't bring Tiger into the house. And when he would come into the house, he would find Tiger asleep with me in the morning. Okay, more. Please don't go away. Alon, we are going to love each other in just 1 second. So here's the deal. If you have a pet, bring your pet close. Because you know that, again, when you come home from a long day, your dog or your pet changes your mood. Because it's not always about us. And as Dr. Selzer just said, it's unconditional love. Don't go away, more on Healthline and the power of the woof when we come back. Welcome back to Healthline again. It's all about the power of the woof. Joining us from Therapy Dogs International, and being a gentleman, I'm going to reintroduce her first, Karen, and of course, on 4 delicious legs, Alon, and from Glendale Adventist Medical Center, Dr. Erin Selzer, physical medicine rehab specialist. We talked before you joined us, Karen, about some of the physical gifts that a patient will feel when a dog, or I want to say a service dog. Is it service dog?
No, it's not a service dog. That's very, very different, and a long story right there. A therapy dog is invited to come to where she works.
A service dog is with somebody that actually needs the animal to maneuver through their life.
They're helping them with a disability they cannot do for themselves.
Okay, so I hope you as well made that distinction. And Alon here has assisted in some of the physical health, but some of the mental health that I want to talk on is lifts spirits and lessens depression.
Yes.
Share with us why, how. And again, we talked how unconditional dog love is.
Part of it is it takes their mind off of where they are.
Okay.
It takes them back to a warmer place, a fuzzier place. They might have had a pet. But they relieves the feeling and the sterility of a hospital. To have a dog come in and be able to pet and be with something that's warm and caring and unconditional love.
And it also takes your mind out of, because the next comment was feelings of isolation and alienation.
Exactly.
Yes.
Encourages communication. Doctor, tell me about that.
Well, dogs help us socially. They, many of us talk to our dogs. Many of us feel our dogs speak to us too, which they most undoubtedly do. But when you're in a hospital, you're around medical personnel who are often not necessarily talking in a language that you understand. And so if you perhaps don't have family members around or friends around, you are very isolated. But a dog, again, is something, an animal that most of us have had experiences of closeness with, and who bring comfort, and who can bring us out more.
Increases socialization, as you addressed, reduces boredom, lowers anxiety, and Karen, help me on this one, helps children overcome speech and emotional disorders.
Dogs have no judgment. I had one
can
dog.
Can you say that again? That's so
Dogs have no judgment. Alana, we're going to lose you down there.
She's becoming a diva, like I'm on camera far too long.
A child's reading and a child reads to the dog. The dog doesn't turn around and say, you said that word wrong. The dog listens intently and is happy to listen to the story. Thereby the child learns to read better. Child uses words, has a lisp. The dog doesn't care. The dog feels the comfort in the words and the expression. The vocabulary is not always as large, but they're feeling the emotions. An older person wants to talk to the dog, and the dog's not going to react unless you talk to them and say, come. So they're going to want to talk to the dog. Alon, up. Come here.
I love that. So you two work together. So then, doctor, you would then invite Karen and Alon to come to the hospital and visit the patient.
Yes.
Is it a disabled patient as we talked about? Or can it just be, if I go in and have my tonsils out, could I say, hey, I would love to have a therapy dog to come see me, or is it more specific?
It depends what you do.
Okay.
At Glendale Adventist, they're using us in the rehab unit.
Okay.
They have had dogs before in the hospital. They don't at this time. And the problem is, I think we'd have to get more dogs.
Yes. Also, when you're on the rehab unit, you tend to be in the hospital a little longer. It's usually a more serious problem.
Got it.
You're disabled. So that's why we have them come and see the patients on the rehab unit. And the patients are all disabled. And similarly to a child that does not respond well to judgmental people, when you're disabled, you know, you're feeling very vulnerable. And I think it's probably similar that a pet doesn't feel any different about you because you know, you've had a stroke or you're disabled.
There's no judgment.
Yeah.
You're just getting comfy.
They're just
Adventist Health is all about, you know, the mission statement is whole person care and God's love. You are invited to participate with the hospital. Is there any special story that comes to mind of an experience that you've had in regards to bringing one of your pets to the hospital?
We do a tour of the hospital.
Okay.
We go around to the different rooms, and I have a staff person with me. And the dogs, by the way, are there just as much for the staff as for the patients because they're pretty stressed out too.
Sure, it makes you
And it
happy,
helps
though.
them feel a lot better, and they're more buoyant afterwards. And we came to one young woman that was very delightful, but she'd had a head injury. And I don't know the nature of it. That's not my business. But she really wanted to cuddle with Alon. She had dogs at home. She missed her 2 dogs terribly. So she asked if the dog, she was going to go to her room, could the dog come on the bed and cuddle with her while she started to take a nap. So they got another sheet to put on the bed so Alon could hop up there, and I gave her the command to hop up on the bed. Now this is interesting because Alon is not allowed on the beds at home. So she looked at me like, huh? A bed? And she happily got up there and she cuddled right up against her, just like she's laying down now and relaxed, and cuddled all along her back. And the girl just rolled over, and I think she's probably went to sleep to take a nap. And I left Alon there. I stayed with her, but I didn't hold the leash. I stayed by maybe 10 or 15 minutes. And she was able to relax and was the girl, both of them, and be very comfortable. And that's what she needed. She knew that, and she requested it.
So then, in situations like this, doctor, and there's someone that has not been, that their health has not gotten better, do you see people getting stronger after visits like this?
absolutely. And this patient, I know exactly who it is.
Love that.
And it was a very young woman in her early 20s who unfortunately had been struck by a car and had sustained a severe traumatic brain injury. And she had some difficulties early on during the hospitalization, but she came to the rehab unit and she did just terrific. She went home so happy and in good spirits and was functioning very well. And she's just a lovely girl, and she loved her dogs.
We're getting ready to go to one last break before, hopefully, Alon will jump up on me at the end. Do you find that when you come into a room and just say there's so much tension and stress, that it's not even so much that it's about the patient, but also the family members and the friends shift because you're invited into room 203 in-come you and Alon, and there's just this change.
There's a change, there's smiles, you know, there's a tenseness there. It's going to be there because of why the person's there. But you come into the room and there's a dog in the hospital, incongruity. Oh, that's wonderful. They smile, they want to touch her, they want to pet her. And most dogs, it's a very physical thing. They get to touch her, she's warm, she's soft, she's loving.
Okay, I love that. No judgment, people. So please don't go away. We're going to let you know how to find out how to get more information from Karen and Alon. Final thoughts from Dr. Selzer. And I'm going to see if Puppy's going to jump on my lap. More with Healthline. Don't go away. Welcome back to Healthline. We're on the last couple of moments stretch. Joining us from Therapy Dogs International is Karen and our four-legged friend Alon, and from Glendale Adventist Medical Center, Dr. Aaron Selzer, physical medicine rehabilitation specialist. So it's all been about the power of the woof. And Dr. Selzer, you were saying that sometimes if a therapy dog just does not come to the hospital, patients are allowed to bring their own dogs downstairs.
Yes, patients who are in the hospital, as you might imagine, miss their pets terribly. And although we're not allowed to bring someone's personal pet up to their hospital room, we do have a common area down in the front of the hospital where we can stage a reunion. And it's really a sight to behold, because not only are the patients overjoyed to see their pet again, but often the dog just goes crazy, just crazy emotional response. And so that's really nice to see as well.
How, now I just, I kind of wanted to make it look like she just loved me so much, but it's all about the power of the treat. Oh, Alon, I know, I know. She doesn't. Hold on, and there's
She's not leaving.
There's another one too. What?
She knows.
Karen, how can people find you and Alon and your amazing services that change lives?
You can contact Therapy Dogs International. If you look on the website, you'll find you can send an email to them and make a request that someone comes to visit you. You can call them if you go to the website and find the phone number. They will put it on their website for volunteers like myself, because I am a volunteer. I do this because I care and because I think it's important. And they'll even send one to an individual home and ask if a home visit is warranted, or if you have hospice, if you want a dog to come to a school, to a library. There are many different ways therapy dogs can come and help you. I'm just going to let her go because she won't go very far.
I'm not giving her up. Any final thoughts, Dr. Selzer?
No, it's just a pleasure to have Alon and her sibling with us in the hospital.
So you heard it here. If you end up in the hospital and you are disabled, all you have to do is tell your doctor that you want to invite a therapy dog, or they will pretty much do it for you. Remember, the most important thing you have is your health. And we at Healthline are on a mission to keep you out of the hospital. Pay attention, stop, look, and listen. As we've discussed, put down your phone, close your computer. Don't be stagnant. Get up, spend time with your family. Remember, the most important conversation you're going to have is about you and your health. So why not have one right now? And I'm going to go back to Alon and see if she's going to cuddle again. We will see you next time on Healthline. Happy summer. Alon, come here. Come on. Did you break up with me already? Come here. Come here.
She knows.
She does.